So today, what I thought I would talk about is back pain. And a lot of times we spend a lot of money with injections and imaging and surgeries, and there can be some really simple solutions to really help with your back pain. And so that's what we're going to talk about today. But first, we're going to talk a little bit about the mechanics. So in our spine, we have these discs, and a lot of times the discs are the culprit of what's going on. And so these discs are kind of are like gel filled or particle filled. As we get older, they become a little bit more particle filled. But when we move, you essentially can move the gel around. And so similar to, think of like a jelly donut. If you push on one end, you can move it to the other end. If you push on the other end, you can move it in the opposite direction. Well, what happens is we do so much things in our life. Like we sit a lot, we're bending a lot. We just do a lot of bending type activities, and our body doesn't recover. And over time, what happens is some of that gel just kind of gets moved to the back because we are bending so much. And when that happens, it just kind of gets stuck there, and it produces pain. And a lot of times that pain will create like muscle tightness and things like that. And so a lot of times what people want to do is they want to bend forward, they want to stretch, and it's really kind of the wrong direction. And here's why. So think about it. If we are bending and we've moved everything to the back, and just by the way, the weakest part of the disc is posterior lateral. What does that mean? That means it's to the back and to the side. And that's where we usually have a lot of our issues. And so what I hear common with people when I ask them different questions is, what are the things that make them hurt? And they'll say, gosh, when I sit, it really bothers me. And then when I get up out of the chair, I have a hard time straightening up. Really, really, really common. Another thing is they'll say, yeah, bending down to pick anything up, or when I stand and I start walking, I actually start feeling a little bit better. And so the things that make people hurt and are the questions that I ask are, trying to figure out their mechanics of what are the things that make it worse, what are the things that make it better. So when you're sitting, you're actually in a bent position. A lot of times we don't sit with good posture, and that's actually a flexed type position, a bending forward type position. But when they're standing up and they're walking, you're actually doing little mini extensions. So this gives me information as to which direction I need to go into that's going to help people. And this is really, really common. So what I do is I tell them, okay, so first of all, we've got to work on going backwards. Let's go the other direction. Just like that jelly donut, if we've moved everything to the back, we want to pinch the other side to move it away from the damaged area. So if we bend backwards, you're actually moving some of that material away from the damaged area. And the things that we want to, and you want to do that often, like 10 of them every couple of hours, where you're either, on your stomach, on your elbows, doing some press-ups, or standing, with a counter, kind of bending backwards, and you want to do it often so that we can move that area away. And as we keep it away, things will heal. Just like if you have a wound on your arm and you're stabbing that wound, that would be like you're not sure what you're doing, you're bending forward, you're sitting, you're stabbing that wound, it's never going to heal. But if we can take the pressure off by not stabbing that wound, by going backwards and taking the pressure off that area, it will heal. So the other things that we need to work on is, if extension makes us feel better, then we've got to limit the things that make us bend. So sitting posture, really, really, really important to put a lumbar support behind your back so that you can maintain a good posture and maintain it while you have your sitting job, because most of us do. And that's going to help keep it feeling good as you keep on doing those press-ups. So anyway, I hope this information was really helpful. It's something that's really, really common. It's so easy to just provide education. Now, just like, extension can be a direction and we can damage those discs on that posterior lateral part of the disc, you can also damage it on the side, on the front, on some sort of, front side area. And if that's the case, extension's not going to work. And I would highly recommend you going in and finding a McKenzie physical therapist so that they can basically move you and test your baselines to see kind of what motion is going to be correct for you. So if that doesn't work, then definitely find someone that is McKenzie based so that they can really help give you some education as to what you can do. Because like I said, 85% of the back pain is really, really treatable, and it does not take a lot of money to do it. It's just giving you education as what you can do. So if you have any questions, shoot me a message. I pull these off, I put them on Empower Physical Therapy YouTube, so there's more education there if you would like to learn a little bit more. Have a good rest of your day.